to so you're welcome to just this interview preparation session for Synergy. I'm opening this up to everyone to join so we can all benefit. My name is Elaine Karem. Thank you for joining tonight. So for anyone that has been, probably you're preparing for an interview, I'm going to ask everyone, please mute yourself so we can have a clear, very good recording. Actually, what I can do is to mute everybody. Okay, please do not unmute yourself. All right, so again, you're welcome to this interview preparation session. It's actually 9 now. So for people, if you're applying for a nursing job, irrespective of the country that you're applying for, one thing is very, very important. It's the job description that you applied for. So if you apply, I know staff nurse, is it just staff nurse in a medical ward? Is it staff nurse in a theater ward? So depending on the job description, you really need to be certain about what you are applying for, okay? So for Ireland, or most of the nursing interviews, nobody is going to be asking you what is bed making, or nobody's going to be asking you any particular procedure. No. So what they usually do is a competency-based interview approach. So competency-based interviews, they are designed to assess a candidate's skills, knowledge, and abilities in a particular area. So they will tell you in this area, so there are common areas, and I'm going to touch base with few of them, most importantly, 3 of them actually, or I think 4. So for competency-based, like I said, they want to test how you can communicate your skills. Now, it's a different thing when you are asked to demonstrate your skills, demonstrating by really carrying out the procedure or carrying out the process. But this time around, they want you to communicate your skill and not demonstrating. So how best you are able to communicate, it determines how well they will be able to assess you and grade you for the job, okay? So in this case, there are particular, what will I call it now, approach that is being used for a competency-based interview question. The commonly used approach is what they call STAR. I'm sure maybe some of you have heard about STAR. So the STAR means S is for situation, T is for task, A is for action, and R there is result. What that means is that situation, you have to describe what the situation is, and then you have to tell us what the task that you are performing or you are asked to perform, and then action, what actions did you take, and the result is what is now the outcome of your actions. So take for instance, you are in an interview. How do you know usually, and let me just say this, if you have not watched my previous videos on how to ace an interview, please go to the YouTube and check. So I'm not going to be going all over, what you have to do for your interview in details, but when you're preparing for an interview, either virtually or over the telephone or over Skype or Zoom or whatever platform, which is virtual, or even if it is physical, it is important that you prepare ahead. You need to prepare. Never go to an interview unprepared. And when we say preparation, it starts from, I've said again, the job description. I've done a video and I've explained I've actually set an example of how I lost a very good job because I forgot the job description, or maybe I didn't take into, cognizance or importance the job description. Oh, okay. Most of the time, we are just so particular about the role. Well, the staff nursing, the nursing role, but there are specific things that are required per job. So you need to go and revise the job description. And yes, you could have made a mistake, or you forgot to save the job description when you were applying. So for Ireland now, if you go through any of this platform or portal, job portals, they will put job description. Maybe there's an application form that you can download. But sometimes it's possible that you forgot to download, or it was an oversight. Now you can request, once you're invited for an interview, while you are accepting the interview via email, you can just write it there and request for the job specification or job description to be resent to you. It is your, what will I call it now? Let me not say, you have the right, or you have the opportunity to request for this. So don't be too shy, or don't be feeling like, oh, what will they think of me? I've not done interview, so you can request for the job description. I'm emphasizing this because this was something that had affected me. And the next time I applied for another job, I did pay attention to that. So that's one. Then the second thing is, of course, you have to be punctual. If it is virtual, think of the network of your location. Make sure you have a very good bandwidth of, your internet is very stable. Make sure you are in a very well lit area. You think of the what will I call it now? The time zone. If there's any time difference, you have to be very, very sure of that. Cross check that, ascertain that before the day, so you don't maybe get absent or you are late. Apart from that, for a virtual interview or either physical, your appearance matters. Don't say, oh, actually, after all, it's virtual. I've conducted interviews with people that will come into the interview not well dressed because it is virtual. The same way you would dress for physical interview, dress the same way for a virtual interview. Very important. And don't forget to look straight into the camera. Look straight. If it's a phone you're using, or if it's a laptop you are using, position your laptop, position your phone in a place where you can have a full view of your face up to your neck, or possibly up to, just like, what will I call it now, a headshot of yourself. And make sure that, like I said, face the camera, your eyes to the camera, and smile as much as possible. Put on a very, very smiling face. Now, I'm saying all that because virtual, sometimes you feel you are not there, but your appearance really speaks volume. Okay. Now, let's go after all the preamble. Usually, this is how the interview will start. You have some, people, the panel. It could be 2 or 3, all seated, and you need to face them, and they'll ask you to introduce yourself. They can say, just introduce yourself, or one of them might introduce you. So if you are being introduced, then of course, courtesy, thank you very much. Some may say, oh, this is Collins, this is Ada, and this is Nika. Collins is, so they will introduce themselves. So one thing that is very important is, as I'm mentioning their name, pay attention. And when you are responding, then you just say, thank you, Collins, thank you, Mary, and thank you, Ola. So it shows that you are present. So, and of course, sometimes they might ask you if you need some water. So get a cup of water or a bottle of water beside you, so that when you're talking, you can sip some water in between, so you don't just go dry on yourself. Okay. Now the interview has started. They will tell you, like, we have so we are going to cover so area. This person will cover this area, another person will cover this area. That's the way it goes. So the next thing is, like, I'm talking about, I'm focusing this now on competency-based interview. But before they start asking you details about the competency-based approach, they will ask you to talk them through your CV. So some would say, okay, they can ask you specifically where you work now, what you do now, what is a typical day like. So those are kind of like some preamble questions as well. So if you're asked, what is your typical job role? Like, it's like, that is what you're doing at the moment. They just want you to talk about your daily routine. So of course it's important. You can start anyhow, but you might have to start, like, you are an early riser, or you sleep late, or you rise early. They just want to get to know you. Be as natural as possible. Be as natural as possible. Try not to cram anything. Don't go into the interview session cramming, or maybe you have arranged some things in your head. Be as natural as possible. So if you're asked to run through your CV, the way they ask you, they will say, talk me through your CV. So start with your most recent. So this is how I used to start. I'll say, thank you so much for that question. I will take you through, talk you through my CV. At the moment, I work as so in so hospital. I've been there for the past 2 years. You can go back and say, I actually graduated, start from where you graduated. They don't need you to talk about your secondary school or your primary school. Nobody wants to hear that. In fact, nobody wants to know the year you started BSc nursing. What is important is your registration. So you can say, I got registered with the Nurse and Military Council of my country in the year 2016. And I started working in a local pharmacy. We just go around, and then I moved to an hospital where I was working as a theater nurse. I worked there for about 6 years before moving to. So they just want you to talk through like that. So you don't need to talk about details. And then I moved to Aba, the social hospital, where I worked as a clinical nurse specialist before I got to where I am at the moment. I am working so I've been in this place for the past 11 months, and that is it. That is all they want you to. So alongside, apart from your work experience, you might want to talk about, I'm a registered nurse. I have my BSc so year. I have my master's so year, and that. So that is how to talk through a CV. No need for excessive talk. No need for you. They don't need your age. They don't need your marital status. They don't need your hobbies when they're asking you, talk me through your CV. I hope you are following. Now that you talk them through your CV, they will say thank you. And now you can start the competency-based interview. So, like I said, there are approaches and there are specific skills that they're looking for. The first one, and most important, that will come across almost every interview, is planning and organizing skills. You might want to test your planning and organizing skills as a nurse. So the question will be, can you describe to us, or can you tell us about a period where you have demonstrated, or you have demonstrated the planning and organizing skill? Like I said, it's competency-based. They want you to talk about a situation. They want you to talk about how you demonstrated a skill, they want you to talk about it. So planning and organization skill. First of all, you don't have to define plan. Don't say planning is this, organization is this. No, They want you to describe, to demonstrate, and talk about, communicate that skill. So I have an example. Remember, I said the approach is using what we call STAR. So you are supposed to start with the situation, go to the task, and then talk about the action, and then you now talk about the results, and then you can, summarize. So I'll go with an example. This is a situation. Remember, we're talking about planning and organization skill. So we are asked to demonstrate, and whatever I'm saying, I'm not asking you to cram it. You can apply it to your own situation. See, it is much easier if the story is coming from you, if it's something that is actually real or that actually happened. Okay. But now again, it is possible for you to if you have not if you can't really remember, or you don't know how to put, you can role play. I've done this before. Like, you can role play and talk about something that maybe you did not eventually do or didn't happen to you, but put yourself in a situation that if you are in that situation, what are you going to say, or how are you going to perform? So when you are reporting that, you'll be reporting it as though you actually carried out that procedure or that situation happened. Okay, so that's just for you to know. No, so now this is a situation where how you can explain planning and organization skills as a nurse. The situation. Now you don't have to say, I want to talk about the situation. No, you don't have to call it out. It is by what you're saying, that they will know, oh, she's stating the situation, he's stating the situation. So listen now, this is a situation. During my time as a registered nurse in the emergency department, I was assigned to manage a high volume patient load, which required a significant amount of planning and organization to ensure that all patients receive the appropriate level of care. That is a situation. During my time as a registered nurse in the emergency department, I was assigned to manage a high volume patient load, which required a significant amount of planning and organization to ensure that all patients receive the appropriate level of care. Now, if you have not worked in emergency before, apply this to the area where you work. Just think about the time that you worked in your work area where you know that you have to plan. Everybody has to plan. Everybody has to be organized. Now, the task. My task was to effectively manage the patient load while ensuring the quality of care was not compromised. This required me to prioritize tasks, delegate responsibility to other nurses, and communicate effectively with the medical team. That is the task that you performed in that situation. Now, what is the action that actually took place? To start, I created a detailed patient care plan that included a list of each patient's needs, medications, and potential risks. I then prioritized tasks based on the patient condition and completed each task in a timely manner. I also delegated tasks to other nurses to ensure the efficient use of resources and communicated regularly with medical team to ensure that patients received appropriate level of care. That is the action that you perform. Now, what is the result? So as a result of my planning and organization skill, I was able to effectively manage the patient load while ensuring that all patients receive the appropriate level of care. In summary, now, like I said, you don't have to be saying task in summary. You can just say, so at the end of the day, my ability to plan and organize effectively allowed me to manage a high volume patient load. So you have demonstrated, or you have communicated there what you did, a situation where you have planned and you have organized in your workplace. So Now think about any other thing. Now, something that I say most of the time again in any interview, if I'm asked this question, is I will talk about punctuality, how I ensure that I'm punctual to work, how I ensure that calendar. If you have any task or any deadline or any assignments you have to do, using calendar to organize your timing, being punctual, taking to time, very important. So think of anything that you yourself you do on a daily basis to help you plan your day and to help you organize things. You don't have to be the world leader or or the world or the matron before you are organized. I hope you get. So that is planning and organization skill. It's a very common area that you'll be asked in a competency-based interview. Now, the other skill that you might need to demonstrate is what they call, sometimes they'll put this together as, what did they call this? Leadership and management. So they'll just put maybe leadership alone, or they say management and leadership. So how do you demonstrate? They will say, tell us a situation where you have demonstrated or where where you have demonstrated leadership, or you have showed leadership in your area of work. So like I said, you don't have to be the chief matron before you show, demonstrate leadership. The common one that I used to say is that there was a time that I was working a particular, you mentioned the word where you worked. Remember that you have talked about your CV, so make sure that it is related. You can say, at the time when I was working in St. Luke's Hospital as a staff nurse, um, I I was working on this particular day that I was working with a team of other people, like 4 other people, but they were sort of all new, and I'm the oldest nurse in that unit, even though I'm not the most qualified, but because I've been in that, I had to lead the team on the day's role. So think of that situation and talk through it using the approach STAR. What is the situation? What was the task? What was the action? And then what was the result? Okay. So let me look at this other example here that you can use. So another skill they might want you to demonstrate is commitment to providing quality care. So they want you to communicate or demonstrate, talk about a particular time where you showed commitment to quality care of a patient. So let me read out this for you. The situation during my time as a registered nurse, I was assigned, I hope I'm talking about the same thing. I was assigned to manage a patient who required a high level of care due to their complex medical conditions. This patient required frequent monitoring and interventions, which required a high level of attention to detail and commitment to providing quality care. That is the situation. Now, my task was to ensure that the patient care was always of highest quality and that their medical conditions were managed effectively. What was your action? To start, I developed a comprehensive care plan that included all of the patient's medical conditions and potential risks. I also made sure to stay up to date on the latest medical research and developments in the field. So when we're talking about commitment to quality, remember or to quality care. First of all, when we talk about quality care, that means you have to make sure that whatever care you are providing is quality. How do you ensure that the care you are providing is quality? It's by following the procedures and policies or your practices thereabout for that particular procedure. is by maybe doing checklists, performance improvement, evaluations. All this are ways to, ensure quality. Now, an example here is making sure that your whatever thing that you are providing, whatever service you're providing is, researched, is up to date when it comes to research and health development. So another thing about quality care, if there has to talk about commitment to quality care, is that it doesn't come in a day. It requires, frequent practice and practice and practice. So that is about the action. Now, the result is that as a result of my commitment to providing quality care, the patient medical conditions were managed effectively and they experienced positive outcome. Then you can then summarize what you have said in terms of the situation, the task, the action, and the results. So I have this script here that I've developed. I would share it with the mentorship group and then maybe put a link there, put in a PDF folder where you can access it even via the YouTube link or so that everybody will have access to it. And you can go to, remember, like I said, this is not for you to cram, it is for you to study so that you can have a better understanding to apply it to your situation. Now, the fourth one I've talked about, what was the first one I talked about? Can you put in the chat? The first skill that you need to demonstrate or that you may be asked to demonstrate in a competency-based interview. Put it in the chat box there. What's the first skill that I mentioned? What's the second one? How many have I mentioned? Just to be sure that you are listening to me or you are following through. Thank you very much. Planning and organizing was the second one. Leadership and management, yes. Was the third one? Thank you. Yes. Commitment to quality care. It's not just commitment. Commitment to quality care, very important. And that's sometimes you can be asked, they can ask you to talk about that commitment to quality care. Now, this is something I've also done or that I've in my interview. You can talk about a time where you provide or maybe you carried out a quality improvement initiative in your place of work. For instance, a very common example that I used to use was when I was hand washing champion in my ward. I was the hand washing champion in my ward, and I kept on. I was using observation skill, to observe the staffs and healthcare professionals. Especially that was at the peak of COVID, how much people were, washing their hands. And as the champion or ambassador, all I had to do is to remind people, and to call attention, you haven't washed your hand. Have you washed your hand? And I was doing that so that is a quality improvement initiative. So, and like I said, even though you have not actually, maybe you can't remember anything, you can coin up, let me put it that way. You can just bring out something from your experience. Okay, sometimes I would say just think yourself as an actor in that place, play that part, play it out. To be honest, I have actually describe if I describe some situations that never actually happened, and just put yourself in that. If this happened, what will you do, or what are you supposed to do? That is what you have to communicate, because sometimes you can be taking, what will I call it now? You can be very surprised, or you are not expecting that question or that area. but you have to think through quickly and talk about it using what are the four key steps? What are the four key steps when it comes to competency-based interview? What are the four key steps, the four key areas that you have to cover? Put it in the chat box. I've talked about it. The four key steps, yes. Situation, task, action, and results. Yes, thank you. So that is it. So just go through it. And like I said, you don't have to say, this is the situation, this is the task. And now I want to talk about the action. Okay, now the next, no, you don't have to go through all that. All you just need to do is to keep talking. Okay. Now, let's talk about another skill. I don't think I've mentioned this. So for this skill is asking you to describe a time or a situation or period where you have built and maintained a strong relationship with your team. So some people will call this teamwork, where you have demonstrated teamwork. Or they might say where you are building and maintaining a strong relationship. Tell us about a time, any situation where you have demonstrated this, or where you have acted out in this particular role in your work. They will ask you, you can talk about the previous role, you can talk about your current role, anyone that you think you remember so well, that is the one you should talk about. It doesn't necessarily mean where you're working at the moment. Okay. So, and that's why I said preparation is very important. You can prepare ahead, but each of these skills that I'm talking about, you can prepare ahead. Like, what will I talk about if I'm asked how I demonstrate leadership? If you want to write it out for yourself, write it out, or it is, like I said, do not cram it. Write it out that if I'm asked how I have demonstrated, or how I had demonstrated leadership and management. Think of which area, bring out your strongest point, your strength, where you can talk more. If it's a very interesting environment, think about it, and that is what you should focus on. Okay. Now, the next one I said teamwork, or sometimes they can ask you how you build and maintain relationship. So let me talk about the situation here. So during my time, and you remember I'm saying during my time, you don't have to keep saying during my time. You can say 2 years ago where I was, so you can start that way. You can say, when I was working as a nurse tutor in Seventh-day Adventist School of Nursing, I was assigned Seventh-day Adventist Hospital. I was assigned to work with the patients who had a complex medical history and was experiencing a range of emotional and psychological challenges. Now, let me pause there. You don't have to use too much Oyinbo or dragged grammar. Be as simple as possible. Because I can see here that maybe you don't be thinking that, oh, all this grammar or all these terminologies. No, be as simple as possible. So let me continue my situation there. So this patient required a high level of emotional support and assistance, which required me to build and maintain a strong relationship with them. What the task? My task was to establish a positive and supportive relationship with the patient, which would help to improve their overall well-being and ensure that they receive the best possible care. This required me to be empathetic, attentive, and responsive to the patient need. Now, this is something I want us to also, talk about and be aware of. Each person has their strengths. So while you are describing this situation and talking about more like this storytelling, make sure you are emphasizing and you are hammering more on your strengths, the strengths in those areas. For instance, what I just talked about, we were talking about building and maintaining relationship. What are the key skills or characteristics that you need to demonstrate in building and maintaining relationship? This person is empathetic, attentive, said, I'm a very good listener. So, I pay attention to what people say and I give positive feedback. So those are the kind of words that you have to be saying. Or you can say, oh, you're not very aggressive or agitated, you will listen, you're open to correction. So those are the things you have to talk about. What is required of you for that particular role or for that particular characteristic. So I'll go to the action. So to start, I took the time to establish a positive rapport with the patient by actively listening to their concerns and taking the time to understand their unique situation. I also made sure to communicate with the patient in a clear and compassionate manner, which helped to build trust and establish a positive relationship. So that is one way you can demonstrate this. Then throughout the patient treatment, I continue to maintain a strong relationship with them by regularly checking in and providing emotional support. What was the result? As a result of my effort to build and maintain a strong relationship with the patient experienced improved emotional well-being and was able to cope with their medical challenges. Yeah, so like I always say, don't just talk about the situation without talking about the result or the outcome of your action. And remember, it had to be positive. And sometimes they will ask you that, is there anything, any learning curve for you in that situation? Maybe you have done it this way. Do you think that you will have done it better? And what is that thing you would do better? So those are like some follow-up questions that can come. All right. So I've talked about 4. So I think that's the 4th one. Planning and organization. We talk about leadership and management. And then I also talk about building and maintaining relationship. Okay. So is there any other area? Let me look at it again. Any other skill that is required? So I've talked about providing quality, commitment to quality. Yeah. And I've talked about planning and organization. Okay. So I think those are the 4 most common ones. The other one, okay, I've talked about quality, I've talked about leadership, I've talked about commitment to quality, I've talked about, I hope I'm not leaving anything out. Let me look at this again. Planning, organizing, building and maintaining relationship, commitment to providing quality service, and then leadership and management. So those are the 4 areas that are very, very common that you'll be asked, to demonstrate or to communicate your skill. So I usually sometimes it could be very overwhelming because all eyes are on you. One thing that you need to do, even if it's virtual or physical, keep your eyes, or move your eyes around, try to get that gaze, communicate. Your gesture, your body gesture must also be talking. Everything must talk, not just your mouth. If you need to use your hand, to demonstrate, to give you that space, use it. Now, again, like I said, if you can't remember anything so similar, or you have not experienced, or you have not really, you can say actually that you say that you have not had that experience before, but if you have that experience, this is what you are going to do. Now, I have attended an interview before and I was asked so something that I have not really been in that situation before. So I can't really, talk much about it. So what I said was, well, I can't remember honestly any particular situation where I've been this, but if I happen to be in that situation, this is what I would do. And then you still have to go through your star, your situation, your task, your action, and the results. And like I said, sometimes they'll come back and tell you, is there anything you learn in the process? Or is there anything you feel like you want to improve upon, you know, from your reflecting on what you did? Now, that question can be tricky because you don't want to, what will I call it now? You don't want to bite yourself in the shoe or in the feet. So, for instance, a very common way to overcome that or to deal with that, when they ask you that do you have, for instance, if they say that do you have any weakness? So, one thing that I always say very common to myself is that I'm a multitasker. So I multitask a lot, and sometimes, it could be very overwhelming. But how do you overcome being a multitasker? How do you deal with that? It is now you bring your strength again, which is planning and organizing, that you ensure that, I plan my time, plan my calendar, plan my task using, you can say you are using an app or you are using a particular resources to help you manage your time. So, I've said that nobody will be asking you what is a diagnosis or will be asking you a procedure for an interview, not interview. What you'll be asked, is this in this competency based to is to communicate your skill in the areas that I've mentioned. So I hope you find this very, very useful. And just to round up, because I know the time is fast spent, to round up on this part again, depending on the job description, depending on the area of you're working. So this is a quick tip for anyone preparing for interview. I know some people here from the mentorship group that are preparing for interview. If you are interviewing or if you are attending an interview for a nursing home, now there are peculiar questions, related to nursing home that you should expect. Now I'll give you this tip. Number one, that you may not be able to avoid, is safeguarding. So elder abuse, safeguarding issues, very, very important here in Ireland and most developed countries. So you want to give a little revise on what safeguarding is and what you should do and not do regarding safeguarding of an elderly person or a vulnerable person. So sometimes they might want to ask you, again, it's going to be a situation, they will ask you, has there been a time, where you ensured, adequate safeguarding, or they can give you a scenario and tell you that so a person was in this situation, or maybe you have a safeguarding concern, for a patient in your ward. What will you do? You have a safeguarding concern. So over here, there are policies, when it comes to safeguarding. So what you can say, or what I usually say, is that I will first of all, if there is a safeguarding concern or somebody has reported a safeguarding, noted a safeguarding issue, of course, what you have to do is to assess the situation. So say I will assess the situation and establish that the patient is safe. Patient safety is very important, it's the most important thing. So even if somebody came to report to you that they kind of feel like this patient has safeguarding issue. Safeguarding issue could be, like I said, please go and revise elder abuse, different types of elder abuse, and safeguarding concerns for older persons or vulnerable groups. So common safeguarding concern could be maybe you realize that maybe the family is extorting the older person. It could be financial abuse, it could be sexual abuse, or anything that could distress the patient, or the patient or the residents. Now talking more maybe in nursing homes or even related hospitals now. So pay attention to safeguarding. You might not be able to get, uh go past that. Now the other question that they might ask you is medication error. Again, nobody will ask you what is medication error, what are the types of medication error. They will be asking you how you dealt with a situation where there was medication error. What will you do as a nurse if maybe on resumption to duty you find out that another nurse skipped or forgot to give a particular medication, or maybe something, they will give you the situation. So all you have to do is to talk through what you will do in that situation. Again, using the situation, the task, the action, and the results. Okay. So if it never happened before, please make sure that you can say it has never happened before, or if this happened based on your knowledge and your experience in that particular area, this is what you would do. So with medication error, of course, quickly, please revise this as well. Again, the safety of the patient is very important. Make sure that the patient is safe, even if they are taking the wrong medication. Patient is safe, and then you inform the doctor in charge, nurse in charge about the situation, and then you document, make sure you document that as well. So there's what the incident report, you have to document it. So those are the kind of things that you say, and then how did it happen? From whom did it happen? And you have to go back and revise. So those are the things you can talk about for medication error. If you need to involve the pharmacy or something like that. So that if it requires an antidote, maybe an overdose, please, you just act accordingly. Now, I've talked about safeguarding, I've talked about elder abuse. Let me see. The other thing that's very common for maybe nursing home question that may come up is family communication. So, and this is not just for nursing home. Most of the time you'll be communicating a lot with the family. They want to know how well you're able to pass, the right information, and to be sure that everybody is on the same page, especially with family. You can have some aggressive family, you can have some very disrespectful family. I'm sure you know that already. So has that be a time where you actually demonstrated, where to perform that, to talk about that skill, where you talk to a very, let me say, a very common one is a family that was frustrated or upset, so to say. So how do you go about it? Remember, again, I've talked about some skills, some key attributes that you need to talk about. Active listening, you know, um, you're very soft spoken, you listen to them actively, you allow them to express themselves, and then you speak slowly in a very clear manner, apologizing for any distress that has been caused or any inconvenience, and making sure, so think of that situation. That's what I always say. Just visualize the situation and communicate. Just talk about what you would do if you were in that situation. Okay, so the family communication is very important. How do you deal with an aggressive family member, or how do you, manage an upset family member of an elderly patient? If a family is refusing care for their loved one, how do you manage that? So don't forget, in situations like this, make sure that you're always mentioning that you carry your manager along, or the nurse in charge, or the person in charge along in this situation. So that's still about communication. So those are the kind of like three common areas for nursing home. Infection control, don't forget as well. So you can have situation like that where you have coexisting, let me put that way, of different infection or infectious agents in the hospital or the nursing home, like COVID, all those things. They might ask you they want you to communicate, to just talk about how do you handle isolation, or something, you have CP, you have COVID, you have another person with flu. How do you prioritize the care of your patient? That can be some situation as well. They can tell you different situation and say, well, which one will you prioritize, and why are you deciding? Why are you choosing to prioritize that? So that's about nursing home. I'm trying to see if there is any other one I can think of at the top of my head here. So another common is, falls. They can give you a scenario where a patient fell. This is a nursing home as well. So a patient fell and it was reported to you as maybe you are the nurse in charge or so. What will you do? How will you handle the situation? So again, revised fall is important. You have to revise fall. So how do you manage that? How do you manage that? If a patient fell, first of all, you need to check, make sure that the patient is safe, patient safety, the environment is safe, take off anything that can injure the patient further in that environment. And that's how we check the vital signs of the patient, make sure the patient is comfortable this time. And then you can document, do your incidents reporting. And if it's a night time, then if you can still call, inform the family member about the fall, inform the medical team, call the medical team to review the patient's ASAP. Is there any head injury, or did the patient hit the head on, all those kind of, so just talk about it, the things you would do, and continuous monitoring of the patient. Okay, so I think I've given you enough there. Just revise. I'm very sure one, if not two or three, or even all of these that I mentioned, we will be asked. So just revise, and like I said, you can react ahead. If I'm asked this question, this is what I would say. If I'm asked this question, this is what I would say. So at least that would be very helpful. Now, the other one, absconding. A patient abscond, what will you do? A patient abscond from your ward and you are the nurse in charge. Okay, or you are the only one nurse on duty. What will you do? So there's that absconsion policy. Again, it's making sure if it's really ascertained that the patient has actually absconded, the first thing you have to do is to ring the police. Just ring GADA. Here in Ireland is GADA. So just ring the police and report that, absconsion. And usually they will ask you for details of the patient, and then once seen, they will bring back the patient, and then you have to fill in your incidents report and inform the family and debrief your team member about what has happened, so that everybody can be on the lookout some other time. Dementia patient, how do you manage a dementia patient that's refusing to eat, and this patient actually is diabetic, and the blood sugar has been erratic? How do you manage? That's another one. Complaints management. So that's another. How do you manage complaints? So like I said, in a nursing home, you will find a lot of older people, of course. So, and families who have so many complaints, so many issues. So you might want to think about that as well, if you can be included. I'll give you another tip there, and we round up shortly. It's open disclosure. So These are the common things coming up now. So open disclosure. Open disclosure means that as a nurse, if something goes wrong, okay, you must communicate same to the family of the patient. You have to be open, disclose. So for instance, open disclosure means maybe you mistakenly gave the wrong medication. I know that you may want to be afraid, oh, I don't want anybody, but even opening up and talking about it to your colleague and to the patient itself, like, oh, this is so that happened. Please make sure that you are open enough and don't be so shy or to be so afraid not to speak up when you're supposed to speak. So it is very, very important. I hope we take cognizant note of that. So above all, I want to wish anyone preparing for exams, I know there are a few people that I know already here, all the very best in your interview. And don't forget to ask questions. So once they finish all their questions, they will come back to you and say, do you have any question for us? So what are the common questions that you can ask that might also help you in your neuro? Okay. Why so many people don't ask about what would be the salary or something? That's because most times the salary or the pay is already advertised, is already in the advertisement, so you already know. But one thing you can ask is that what is the maybe the pattern of progression, or what they call the promotion, kind of. You want to know, is it every 6 months, is it every 1 year, or something like that? So be open to ask questions. You can ask questions about career development or career support. I always ask this, like, will the organization support me, in this particular area? So that's another thing that you need to pay attention to. Ask question. Don't ask too much question. Don't ask 2 questions, 3 questions at most, and make sure you rehearse it as well before the day. All right, so that's all I can say for now. So thank you so much for listening in. I wish you all the very best. I'll send this recording once it's ready. It's going to be uploaded. And I wish you all the very best. Good night.